Slide you over. Where are my comments on here? I still don't understand where comments go. Okay, let's go live. Hey, everybody. Welcome to our live this morning. I'm Dr. Scott. We're talking about if your thyroid is you put it, and then we can go from there. Let me turn that off. Off we're running. So welcome. For those of you on YouTube, welcome here as well. I wish I could know how to do comments. If you're watching on YouTube, go ahead and leave a comment if you wouldn't mind, just so I can make sure I can actually respond to your comments. I'm just kind of new to the YouTube arena, so I'm not sure why I'm not able to see comments here. But anyway, hey, welcome again. Let's talk about your thyroid function and why you're still having symptoms, even though you're having thyroid medication problems. And we'll go from there. So I'm Dr. Scott to give you a little bit of why I treat. The question I get all the time is, why do I treat these kind of cases? Now, I own a medical integrative clinic. Okay. And what we do, and I'm just going to kind of get into this so we can get going here, but I have a medical integrative clinic, and we take the best of traditional medicine, we mix it with the best of natural medicine, and we have fantastic results. We've seen over 7,000 to 8,000 people with hypothyroid Hashimoto's disease, and we have about a 90% success rate and be able to put these into remission. So you can't put it into remission, folks. Now, the question, and so I started all this because of my wife. My wife was having problems, and some of you may understand, we were going from doctor to doctor. If this is you, maybe, put a like or a thumbs up in the comments, but we were going from doctor to doctor. Oh, I can. That is TikTok. Oh, this is TikTok. Oh, gotcha. I gotcha. um, but we were going from doctor to doctor, not getting a lot of results. She was having a lot of fatigue and weight gain, brain fog, and no one could really figure out what's going on. The final solution for her was going to be surgery and a fistful of supplements. I mean, not supplements, but medications. And she came to me. She goes, "Listen, you need to figure this out because I don't want to take medications. I want to figure out what's going on." And that's pretty much where we're at with this. So we were at that point, my life changed. I had to go on a journey to figure out what was going on with my wife. So I spent over $200,000. I went all over the world trying to figure this thing out, and we were able to figure it out. Thank goodness. So it is my passion. I feel like my calling. I don't think that the answers to my wife's solution was only for her. I think it really is for those many people that are watching this video that are struggling, that no one is really helping you. So with that said, let's kind of get started. If you're watching, why don't you go ahead and put in the comments where you're located and if you're new to my live, okay? And what we're going to do is we're going to talk about several different things about thyroid, why you're taking thyroid medication, even though you're not having, man, it's an early morning. If you're on thyroid medication, why you're still having symptoms, okay? So, but yeah, go ahead and put in the comments where you're located and if you're new to my live or if you're a regular. So we got Donna, me, you have Hashimoto's disease of Graves. You had uveitis since I was 3. My body hurts with pain. Sorry to hear that, Donna. There is hope for you. Trust me, we're going to get into this. When you were home in the UK, it's way better. I'm in Fort Stewart, Georgia. Okay, gotcha. London, UK, wonderful. Nice to have everybody here. So the question for you is this, all right? Thanks for joining our live. If you're having fatigue, weight gain, brain fog, all right, let me ask you a question. Did your doctor tell you why your thyroid isn't working? Okay, for those of you that have been diagnosed, did your doctor tell you why your thyroid isn't working? This is the question that you really need to have the answer to is, did your doctor just prescribe thyroid medication to you? Or did they say, okay, this is your thyroid isn't working. This is what's wrong with your thyroid. And we're giving you this medication because this, and this is not working. And this is how the medication is going to fix your problem. Did that discussion happen with any of you? Please put in the comments if that happened. Or did your doctor just send you packing? Here's your medication. See you later. Most of you, probably all of you, it's going to be, yeah, here's the thyroid medication, and that's about it. But let me tell you, if this sounds familiar, I can pretty much predict the story of a hypothyroid patient. And again, put in the comments a thumbs up or yes if this sounds familiar to you. You have thyroid symptoms, weight gain, fatigue, brain fog, your hair is thinning and falling out. You're getting concerned. You're not sleeping very well. You've got depression. And then suddenly what you do is you go to your doctor to go, man, there must be something wrong, right? You want to find out, well, why am I having these symptoms? So you go to your primary care physician and they say, okay, it sounds like it might be your thyroid. So let's run some tests. And the tests that they run is a TSH and a free T4. Okay. They run these two markers and they're going to say, we're going to run a full thyroid panel. We're going to run these two. We're going to run a full thyroid panel, but they only pull 2. And then they come back and let's say it comes back positive, right? Your TSH was higher, free T4 was low. You have a thyroid problem. Let's fix your thyroid problem. And so how do they fix your thyroid problem? Well, they're going to give you levothyroxine, okay? Levothyroxine or Synthroid, right? They give you the medication. And then they say, come back in 6 weeks and we'll relook at it. You come back in 6 weeks, they rerun these 2 tests again, and it looks good. The doctor comes in going, hey, what's up? How you doing? Look, your labs are looking fantastic. We fixed your problem. We'll see you later. Just keep taking the medication. But yet you're sitting there going, well, wait a minute. Let me talk for a second. I'm still having all my symptoms though. Okay. I'm still having all of my fatigue, my brain fog. I'm taking the stuff, doc, but nothing feels different. And the doctor goes, well, guess what? It must not be your thyroid because look, these 2 markers are normal. So here's an antidepressant. Does this sound familiar to any of you that are watching this live right now? Okay. Give me a comment. Yes, a thumbs up if this sounds like you. Because out of the 7,000 plus patients that I've worked with, this is exactly what's happening. Okay. You're going in, they normalize these 2 blood markers, and then they say they fixed everything. But again, what I want you to understand, okay, when you're dealing with this is it's not like you don't need the thyroid medication. We're not saying that. Okay. But what I'm saying is for over 90% of you, look at that number 90% of you that take levothyroxine will see no improvement in your symptoms at all. That's almost all of you. And this is why, like, traditional medicine has really dropped the ball in treating, thyroid cases, mainly because there's only one thing that they are concerned with. And that one thing is going to be hormone replacement therapy. So I want you to understand that the standard of care for for thyroid cases in the United States is only, do you need thyroid hormone or don't you need thyroid hormone? That's it. And this is no different than if you were to go and get checked for low testosterone or low progesterone or low estrogen, and they go, oh, you have low estrogen. Let's go ahead and give you some estrogen. That estrogen is doing nothing for your ovaries. It's doing nothing to fix your problem. It's only replacing the hormone. Okay, so it's kind of like you have a leak in your car. You're leaking oil in your car. And the mechanic says, listen, all you have to do is add oil to your car every single day. Okay, see ya. Now, would you accept that answer from your mechanic? I don't think so. So what's happening is, yeah, I'll add oil to my car. Great, I'll do that. But are we going to find out why am I leaking oil? Because if you don't fix the leak or what's causing your car to leak oil, 5 years from now, your car is gonna be worse because you never fixed it. Instead, you just keep adding oil all the time. And this is why I tell everyone is you need to know the why. You need to find out why are you having symptoms and fix this, the root cause. Now, you hear this probably all the time. You need to get to the root cause of your problem. Yes, but actually what you need to do is you need to get to the root cause of your root cause of the root cause. You do have to peel that onion back till you get to that core reason what's driving your symptoms, okay? And we're gonna go through some of that here in a second. Let's go to some questions, and then we'll go from there. So Denny's asking, headaches are better, okay? Um, yeah, everyone's kind of resonating with this. Your PTH results came back at a level of 87. Should I be concerned? Yes. What about when you're hypo and pregnant? Yeah, so you have pregnant. It depends. You probably have Hashimoto's disease induced by the pregnancies. Now, you do if you have a test, right, that shows that you need thyroid hormone. You need to take thyroid hormone. Now, the type of thyroid hormone may be a different story, but you do need it at least in the short term until you can fix the problem. Okay. Now, 90% of all cases, Angel Fry, I'll bring this up. 90% of all cases of hypothyroid is Hashimoto's disease, an immune system that's attacking thyroid tissue that's causing hypothyroidism. That's what's happening. And taking levothyroxine doesn't do anything at all to fix Hashimoto's disease, to address the immune system problem. It doesn't change the attacking of your immune system to your thyroid tissue. Nothing. It's only replacing the hormone that you're losing from the attack. Okay. And levothyroxine, again, will never, ever put your Hashimoto's into remission. Now, if any of you are watching this and you've been diagnosed with a hypothyroid and taking thyroid medication, whether you know it or not, you probably have Hashimoto's disease, period. And yeah, and traditional medicine does not treat Hashimoto's disease. Look at this number. And let me just redo this here. I'm going to give you an idea. So you have hypothyroid here, hypothyroid. Okay. Here's hypothyroid. Now, most of the time, the cause of hypothyroid is Hashimoto's disease. I hope you guys can see that. Can you see it? Yeah. So Hashimoto's, 90% of all the causes, right? Hypothyroid is Hashimoto's disease. Okay. Now, if you have hypothyroid, what will happen is they'll give you levothyroxine, okay, medication, right? So if you're taking levothyroxine, here's the question that I want you to ask, and this is how you know what direction to go here. Okay, so you probably have Hashimoto's, but unfortunately, most doctors don't check you for Hashimoto's disease because they're only concerned about the low thyroid component. Okay, so you have hypothyroid. They prescribed levothyroxine or Synthroid for you. Now, here's the question. Did your symptoms go away? All right. So you took your levothyroxine. Put it in the comments for me, guys. When you took your thyroid medication, this is what I want you to kind of walk through the clinical thinking here. Okay. You have hypothyroidism. You take levothyroxine. Did it take your symptoms away or did it not take your symptoms away? Because here's what happens. If you took levothyroxine, what should have happened if the only problem that you have was just a low thyroid is all of your symptoms should have gone away completely. Completely. Your fatigue, your brain fog, your depression, your anxiety, your hair thinning, all that should have gone away and you feel awesome. Okay. This is, if it's yes, nothing else to do. You're fine. The only thing you need to do is take the levothyroxine, have a good lifestyle. That's all you need to do. If you're a no here, well, then now what you need to do is find out, hey, do you have hypothyroid, right? Why do you have hypothyroid? What is the cause? Well, we know 90% of the time, what's the cause, right? The cause is Hashimoto's disease, an autoimmune condition that attacks your thyroid gland. And taking this, folks, doesn't change it. And what will happen, and let's say all you are going to do is take the levothyroxine, all right? And that's it. And you just let your immune system keep attacking you all of the time. It's like you have termites in your house. You don't address a termite infection, you just pretend it's not there. No, 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 everything looks good, my walls look good, my roof looks good, and you ignore it for years and years and years until eventually you know what's going to happen. Eventually, the house is going to crumble, okay? And this is what's gonna happen with your thyroid over time, is your symptoms will get worse and worse, your medications usually start going up, and then you start having more and more other problems, and then you're sitting there in a sack of mess, right? And I know many of you right now are feeling that way. You have all this stuff and you're like, "What the crap," right? So here's the secret, okay? I know someone asked, "Well, what do we take?" It's not something that you necessarily take. First thing is you need to find out why. What is going on? You have Hashimoto's. So first off, let me walk you through this. Is how you the first step of that regimen that you do is get a full thyroid panel. Okay. Now, what we talked about before, thyroid panel. Here's your thyroid panel. Walk through it with me. Okay. How many of these did your doctor uh, order for you? All right. Put in the comments how many. Well, most of the time, let me tell you the standard of care. So in medicine, or in healthcare, you have the standard of care that needs to be followed. Here's Western medicine's standard of care for thyroid treatment. First off, if they want to screen you for a thyroid problem, the first test to pull is only a TSH, actually, not a T4, only a TSH. This is the standard. You start with this, okay? If this is normal, nothing else to do. Literally nothing else to do. Google the standard of care for thyroid treatment. You start with the TSH and that's it. Okay. But typically, what you'll see, most doctors are going to pull more than just a TSH. You're going to pull a TSH and a free T4. Okay. How many of those got those two? Most of you. Because the reason why they're pulling these two, because that determines the prescription. That's what those two are for. And that's why that's the only markers your doctor is going to pull for you typically is only a TSH and a free T4 because that's all that they need. And honestly, that's all the insurance company typically wants to pay for because according to your insurance company, the only thing they will pay for your thyroid is the levothyroxine synthroid. That's it. Okay. The prescription part of that. But we already went through the scenario. The prescription isn't working. So there must be something more. So here's what else you need to pull. Now we talked about Hashimoto's disease. So yes, you need to also have a TPO antibody. How many of you had a TPO antibody? Okay, this is the main marker that most doctors are going to pull to determine if you have Hashimoto's disease. TPO antibody. Okay, if you had this pulled, what was your number? Put in the comments what your number was of this. Okay, now what I'm going to tell you, okay, what the number should be. The number should be 0. Okay, but according to Mayo Clinic, anything within below 9 is positive. Now, your lab is not going to probably say 0 to 9. Mayo Clinic's lab does. Quest Labs in many parts of the country does. LabCorp's is 0 to 34, but it should be 0, but 0 to 9. So look at your number, and if your doctor said you didn't have Hashimoto's disease, and your number was higher than 9, well, they're not following the updated research. Okay. All right. So that's the one marker. Let me ask. There is another marker that needs to be pulled to determine if you have Hashimoto's disease. There's another one. How many of you got the other one? If you know what the other one is, put it in the comments. It's thyroglobulin antibody. You need both because this marker can be positive, negative, and this can be positive. But most doctors only pull the TPO antibody. So you need both, definitely both. Okay. And when I finish up the full thyroid panel, I'm going to tell you exactly what your immune system is attacking here and why you need both of these, and why, if you don't handle your immune system, that this Hashimoto's can turn into MS, rheumatoid arthritis. So we're going to talk about that. Okay. All right. So you need both of these. This determines, okay, this determines if you have Hashimoto's disease. Okay. Now, anyone else have any other markers than this? You can DM us if you want to find out how to contact us, or if you want to apply into our program to see if we'll accept your case. You can go to my TikTok profile and do a free discovery call with this, or you can do a full, like we have a special run. Okay. Okay. Anyone have anything more than this? Okay. Look at your labs and how many labs did you pull? We're sitting at 4 here. Here are the other labs that you need to pull. Well, the big one, free T3. How many had their free T3 checked? I'm going to star this guy because that is your thyroid hormone that's turning on your cells of your body, is free T3. Okay. You need to have this free T3. That's the guy that's doing everything. This should be around 4.2. Nothing less than 3.5. Okay. Now, yes, I'm going to talk about gluten-free diet here in a second. You need to be gluten-free if you're Hashimoto's disease. No ways around it. You need to be gluten-free. Here's the other markers you need to pull. You need a free T3, a free T4. Oh, okay. We already have both of those. You also need a total T3, a total T4, a reverse T3, and a T3 uptake. And FDI is cool to have too. And if you need another autoimmune condition, this tells you about Graves' disease or hyper. So if you want to know what's happening with your thyroid gland, you need to have that full thyroid panel. Now, here's the thing. Your doctor's not going to pull all these. The doctor is going to pull these guys. And that's a bit. You might be able to get them to pull this. So if you're sitting here going, hey, so how do I get my doctor to pull all this stuff? Well, in 20 years, I've yet to have probably anyone pull all 10 markers. You're on your own. You can go to my TikTok profile and then go to the right underneath the finger emojis, and that'll take you to that other spot. Okay. If you know what I mean. And you can order the labs. If you're in the United States, you can order these labs. Okay. But you're going to have to do them yourself. All right. So you need all of them. There are 6 patterns that causes your thyroid to malfunction, right? Which pattern are you? Okay. You're most likely Hashimoto's disease. Okay. But out of the 6, most of my clients have 4 to 6. So what I'm going to do is I'm going to go to some comments, and then stick with me, is I'm going to talk about now what Hashimoto's does and why it spreads to other autoimmune conditions like MS and rheumatoid arthritis and Sjogren's and stuff like that. Okay. Okay, let's see here. Blue 222. Does Hashimoto's cause positive ANA? So if you have a positive ANA, that means you have some type of autoimmunity going on. And here's the thing for me, is not necessarily is it strictly for Hashimoto's. Typically, you're going to get these two. ANA is in about 70%, I think 40 to 60 to 70% of people that have lupus. You can have Sjogren's when you have positive ANA. But here's the thing. The label right? When you're diagnosing an autoimmune condition, it's diagnosed based on what that immune system is attacking, okay? So it's kinda like the bully in the playground, right? Your son's named Johnny. Well, okay, if the bully is bullying Johnny, then they call it a Johnny disease, okay? If your son's name's Jim, right, then they're gonna call it Jim disease. If you got a Chelsea, it's a Chelsea disease. But you notice it's the same bully, right? That's bullying Chelsea, Johnny, and Tim. And so for me, it doesn't necessarily matter to me what immune system problem that you have. What I care about is why is this immune system attacking your tissues? That is what you need to figure out. Find out what's triggering your immune system to attack. Then that's how you're going to be able to put this into remission, whether it's RA, whether it's rheumatoid, I'm sorry, whether it's MS or Hashimoto's disease. Okay. Um, okay. Where do we go here? Positive ANA. There we go. All right, let's back up. Bum, bum, bum. I have both Graves and Hashis with nodules and thyroidectomy scheduled. Okay, so here's the thing. If you have Graves' disease and Hashimoto's disease, just realize the thyroidectomy is not going to remove all of your thyroid tissue. Okay, even if you're going to get a radioactive iodine, that does not kill all of your thyroid tissue. So removing the thyroid may remove the emergency, but what happens is your immune system is still attacking those remaining tissues. And what happens is you got this little like glowing ember in this fire that's out, but you see these glowing embers, and all it is brewing inflammation. Now it's going to spread to RA, to rheumatoid, to Sjogren's disease, lupus. So just getting your thyroid removed is not going to fix the underlying problem. Okay, underlying. That's like when you get your thyroid removed. It's like you're taking Tim out of school so the bully doesn't attack you. Well, the bully's going to still attack all the other tissues. Because if you have one autoimmune condition, you have another one, okay? Okay. Yeah, so your Blue Blue said your doctor you had a positive ANA. Yeah, because they're just saying, "Well, there's a certain amount of population." No, you need to get someone to handle it. Reach out to us, we'd love to help you with it. Okay, your glucose cholesterol lately is high, okay. Can a bad thyroid cause constantly elevated heart rate? Yes. Yes, it can, okay? A lot of times, a high heart rate would be because of Graves' disease. A low heart rate would be called bradycardia, could be hypothyroid. Yeah. Let's see here. What should the other levels be? Can you write them on the board, please? Now, that all depends, like, when we're looking at is functional, I don't have time to go through every single one of these. The most important ones are these guys, is really the free T3, okay? That's the main one. The TSH, that's the other one I'll usually tell you. You wanna be between 1 and a 2, okay? This should be below point 0.9. That should be below 9. Whoops, 9, okay? Reverse T3, you wanna be around 22. Now, the key thing is what's attacking that. All right. Amy, how are you? Your TP is over 900, TSH normal, free T4, T3 slightly high, had a positive ANA, and then okay, you have a raging autoimmune problem, Amy. Um, in fact, we talk about the stages of autoimmune progression. Okay, this is going to be really, really important for you for those people that have positive antibodies. Okay, this is stage number 1, stage 2, stage 3. I'm even gonna say stage 4 up here, okay? But here's what happens. This is antibodies. This is symptoms. This is a diagnosis. So, when I say I don't care if you have a normal TSH, a normal free T3, and a normal free T4, but you have over a 900 TPO antibody, I'm concerned. Okay. Now, what your doctor will do is, if this is you, you have positive antibodies and the rest of your panel looks normal. Okay, what does your doctor tell you? Oh, no big deal. We'll watch it. Let's retest you in 6 months. Why do you think they want to retest you in 6 months? If it's not a big deal, okay, if having positive antibodies, whether it's ANA or TPO or thyroglobulin, if having positive antibodies is not a big deal, Why do you think your doctor wants to check you later in 6 months? Put in the comments why you think a doctor wants to recheck somebody's antibodies or your thyroid panel. Like, let's look at your TSH and your T4 in 6 months from now. Why do they wanna check it if you have positive antibodies? Well, I'll tell you, because they know good and well that the immune system's attacking, and eventually it's gonna kill enough cells that now you will be officially hypothyroid and you will need thyroid medication. I don't wanna wait for that. So here's the progression of an autoimmune condition. Number 1, you have positive antibodies, but the rest of your thyroid panel is normal. Normal TSH, normal panel, thyroid panel, okay? Normal thyroid panel. You can stay in stage 1 for years, okay? Now, because you didn't fix the attacking continues. Dead bodies, can I say that on TikTok? I don't think I said it. But the attacking continues, okay? And then you move to stage 2 where you have antibodies, but now you're starting to get symptoms. Now, in this stage, what does your thyroid panel look like? You have a normal, but slightly elevated. So what it means is your TSH is higher, but it's still within normal range. Your free T4 is lower, but you're still in the lower range. And typically the dialogue with your doctor is, well, it looks like you're getting close, you're getting borderline, okay? Um, but you're still within normal limits, but now you're having symptoms now. Okay, now you're having symptoms. Okay. And so what happens in this stage? What does your doctor say? Well, let's check in 6 months from now. Okay. Again, we all know why they're going to check it because they know damage is happening. Because what are they waiting for? They're waiting until they can mark this box. Okay. And when they can mark this box here, what your thyroid panel looks like is your TSH is high, your free T4 is low. Right? So the tissue starts happening. Then you move to stage 3, which you have positive antibodies, you have symptoms, and wow, because your TSH and free T4 are out of range now, now they can diagnose you with Hashimoto's disease. Because to be diagnosed with an autoimmune condition, doesn't matter which one, you have to be able to document tissue damage. And with your thyroid gland, how you document tissue damage is really 2 ways. Number 1, an ultrasound. Number 2, and the most common, is you have hypothyroid. You have tissue damage that your thyroid can't keep up. Now you have to have replacement hormone because your thyroid now can't do it anymore. It's literally the thyroid's been punched in the face so many times, it just can't keep up. And now it needs some help with your levothyroxine or Synthroid, okay? Now, if it's like rheumatoid arthritis, well, what's with that? Well, they'll have imaging like an X-ray or a CT scan. Oh, yeah, we can see the damage in the joints. You have RA. If it's MS, then oh yeah, we can see the lesions on the brain. We do a spinal tap. We can see it. Boom, diagnosed. All right. But why do you want to wait till you get to that point where you have permanent damage? Typically, don't wait. Now you get. What does your doctor do? The treatment's going to be levothyroxine synthroid. Is that levothyroxine Synthroid gonna do anything for your autoimmune attack? No, it's not. It's literally if you were here earlier about we're talking about the bullies in the playground, bullying Johnny, Timmy, and Ashley, right? I know it was Ashley, I can't remember who else I said. And what's happening in that case is it's literally, we're not gonna handle the bully, the immune system. We're just gonna keep putting bandages and Band-Aids on your kids because, the bully keeps attacking your kid. No one's ever addressing the bully. Well, it's gonna get worse over time, and that's what happens. So you get this stage 3, you have permanent damage. Now, it will progress to, like, stage 4 because what happens now? Now you start with Hashimoto's disease, but now you got MS. Now it moves to rheumatoid arthritis or Sjögren's disease or lupus, okay? So that's why you wanna handle this autoimmune condition right out of the gate. I'm sorry, that was kind of a tangent on one question here, but having positive antibodies, you don't do it. Now, remember, Traditional medicine does not treat Hashimoto's disease. So don't go to your endocrinologist or internist or your primary care physician and ask them, well, will you treat my Hashimoto's disease? They won't. Okay. They treat hypothyroid, which is caused from Hashimoto's disease. So they'll treat the hypothyroid. You will need the medication if they have that, test that shows you need it, at least in the short term. But if you fix it and you put your Hashimoto's into remission, there is a really good chance you can come off your thyroid medication. Okay. But just taking thyroid medication will not put it into remission. What's triggering your immune system to attack? It could be food sensitivities. It could be a gut problem. It could be a small intestinal bacterial overgrowth. It could be H. pylori infection. It could be low digestion. It literally could be toxins. Maybe you're exposed to mold. Maybe you've got blood sugar that's skyrocketing up and down and roller coastering. Maybe you got adrenal dysfunction. There's multiple things that need to be addressed to be able to put this into remission. Okay, let's go to a few more comments, and then I'm going to talk about how this happens. How you go from Hashimoto's disease, or maybe you have another autoimmune condition that it turns into other autoimmune conditions. And this, what I'm going to explain to you in a second, nobody is telling you. You will understand why this is happening. Okay. Now let's go through a couple questions, and I'm on the most recent ones here. I'm going to go to Stephanie Prince here. She says, I don't have Hashimoto's. And again, you guys, thank you so much for your likes and your follows. That helps people get this information out to them. So I appreciate it. If you have a loved one that's suffering with this stuff, send them to share so they can watch it. She doesn't have Hashimoto's, just hypo. Is medication the only option for me? So here's the trick. Okay. Now there are 6 patterns that cause your thyroid to malfunction. There's 6 of them. One of them is Hashimoto's disease. The other one is called primary hypothyroidism. What that means is your thyroid is just low functioning. And how you know if you're primary hypothyroidism is you take the thyroid medication and it takes all your symptoms away. So, Stephanie, if you're taking medication for your hypothyroidism and all your symptoms went away, perfect. That's all you need to do is take the medication. That's it. You don't need me. You don't need our program. You don't need anything. But if you're still having other symptoms while taking the thyroid medication, if it didn't take them all away, that means you're one of the other 6. And you have a 90% chance that you have Hashimoto's disease. They said that you were negative. Did they pull both thyroglobulin antibody and TPO antibody? And was your TPO over 9? That's how you know. I don't know how many times people have come in and told me they weren't Hashimoto's disease. I pull a blood test and I look at their Hashimoto's is at 20, but the lab range on their blood work was 0 to 34. So their doctor said they don't have it. And then what I do, and I suggest all of you do this, Google Mayo Clinic TPO antibody lab tests. It will take you to Mayo Clinic's lab testing page on TPO. You go down to the reference range, and their reference range is 0 to 9. Okay. So if you're over 9, you're positive. Really, if you have any number there, you're positive. Okay. All right. Brooke, sitting here with hyperthyroidism and arthritis. Ugh, still so much to learn. Graves' disease diagnosis. So Graves, autoimmune. Hypothyroid, Hashimoto's, autoimmune. We address both of them. You can't put Graves into remission. And I have a lot of patients that were able to come off the methiazole medication and the other meds that they take when we've been working with them. So there is hope for you. You're not stuck. Castor oil packs, they're okay. Not for cancer. I mean, if you have cancer, you're gonna need to get that out. I would not mess around. If you have a documented thyroid cancer, yeah, you're gonna need probably a thyroidectomy, or they'll do RAI, and sometimes they do both. So it's like, yeah, you need to get that out because the thing with that is, thyroid cancer is very treatable. The prognosis is very, very, very good, and don't mess around with it. You don't want to get it to your lymph nodes, and then obviously you have bigger problems. Don't. That's my suggestion. I would not mess around with that. Don't try to do castor packs if you have cancer. Bite the bullet and get that thing out. I mean, follow your oncologist. I mean, when it comes to emergency medicine, they're fantastic, right? But when it comes to chronic cases, not so much. Yours is an emergency. Get that sucker removed. Thyroid peroxidase antibody is very high. What does this mean? You have an autoimmune thyroid. Your immune system is attacking your thyroid gland. So you only treat Hashimoto's and thyroid. You don't treat rheumatoid. No, we do. What I'm saying is it doesn't matter to me what type of autoimmune condition. The approach is the same. What's triggering your immune system to attack your cartilage? It's no different than why is your immune system attacking the thyroid cells and for Hashimoto's? That's what you need to figure out. So, we don't just treat Hashimoto's, we help all autoimmune conditions. We do a lot of other chronic conditions like GI problems. Because the thing with when you're dealing with autoimmune conditions is it's a multi-system based problem. You've got some endocrine system problems, you've got immune system problems, you've also, got, other issues and other systems like GI function and toxicity. All these things are all wrapped into one. You have to treat you to pull yourself out of this. To give you an idea, part of what we do is we try to make sure we treat your cells. We wanna make sure your cell can get the good stuff into it and the bad stuff out of it. Okay. And if you go to my Google reviews, if you Google chronic care of Utah and look at my Google reviews, scroll way down. There's a person on there called Vicky Larson, just to tell you the power of all this. She came in with hypothyroid Hashimoto's disease, had weight problems, right? But here's the thing, and she tells you this. What she did not tell us is that she had 3 open wounds on her lower leg. They were gruesome. She showed me pictures. Like when she moved her foot up and down, okay, you could see her tendons moving up and down. And what she says on her Google review, that she had these for 27 years. Imagine that. 27 years she had these open wounds that never healed. And it was not from diabetes. It was because she got radiation as the trigger. And what she told me, she goes, within 4 months, those wounds healed completely, completely. She wasted almost 3 decades with these wounds, and 4 months with me fixed them, like literally fixed them. And you can read this in her Google review. She literally said the wound doctors were amazed at the improvement. What actually is they thought it was a miracle, okay? So the power of fixing your cells, yes, we had to fix, everything, and then the byproduct of that is these other problems that we didn't even know she had actually resolved too. And if you're struggling and you wanna work with us, you want to apply to see if we'll accept your case, um, we work with people literally all over the globe. Yeah, we're in over 10 different countries with people we're working with. If you wanna reach out to us, there's multiple ways. Pick the one. You can DM us, you can, email us, you can call us directly. Probably the best thing that you can do is actually go to my picture up here, click on it, and then another box comes up. Click on the picture in the box, my picture in the box. Now, when you click my picture in the box, that will take you to my actual page, okay? My TikTok profile, and you'll see these little finger emojis. Go right underneath there, and that's gonna take you to where you can schedule a free discovery call. That's what we like to do first is do a free discovery call. Just talk with me and my team real quick to make sure you're in the right place, okay? Now there is a special on there for $397. You can get lab work and a full consultation for literally $397. You're getting $4,000 worth of testing. So if you're trying to accelerate the process, you wanna get these labs, then you can do that too, okay? So, okay. Wound doctors can't heal them. Mama, yeah, I'm not sure what you're meaning by that, but, no, wound doctors do a great thing, and, what they were trying to do with Vicky was they were trying to eventually try to get a stem cell treatment. The interesting thing is, though, is in our clinic, I own a medical integrated clinic that we take the best of traditional medicine, take the best of natural medicine. We do stem cells, you know, but we never did any stem cells with her at all. It literally was just our thyroid support with her. Yes, we can help you in Canada. Okay, now the special that you see on the main thing is literally, for US only, though. I've had Hashimoto's disease, thyroiditis since 5, now 42 on Synthroid level, liothyronine. Can I be helped? Okay. If any of you are taking liothyronine or Cytomel, okay, I know that not only do you have Hashimoto's disease, that you're not converting your inactive T4 hormone into the active hormone T3. Because liothyronine is only a T3 hormone. So that means your doctor must have seen a test that you were low T3, but your T4 was normal. And most of the hormone, the active hormone your body uses, has to go through this conversion process because Synthroid is T4. So when you were taking T4 this whole time, your body has to take the T4 and convert it into T3, but it wasn't doing it efficiently. And that's why your doctor probably gave you liothyronine. So any of you that's happening. So now you know if you're not converting 4 into 3, why aren't you converting 4 into 3? That's what you need to figure out. Okay, a couple more questions, and I'm gonna talk about autoimmunity again, about how your Hashimoto's can spread to other conditions. And then we're gonna talk about specific things that you can do. Let's see how far back we are. Okay, how do you start trying to figure out what is attacking my thyroid? Nodules, no antibodies, high TSH. Yeah, Mackenzie, great. So now make sure with the antibodies that you get both your thyroglobulin and your TPO antibody. Okay, because your TPO, which most doctors pull, can be normal, you have a positive thyroglobulin. And even on your TPO, if you weren't in here, anything over 9 is positive, okay? Now, high TSH, I just need more information on this because you could be subclinical hypothyroid, but there's something going on with your thyroid for sure. You had a bacterial infection and immediately after a viral infection, this trigger yep, that definitely will trigger it. Yeah, dental health is very, very important. Realtor Kim, you do have Hashimoto's and trying to lose weight, is walking 3 miles and incline 13, good. No, I like actually incline 13, that's what I do. Not on all my workouts, but that's a good way to go, but here's the thing, if you have Hashimoto's, the thing is your thyroid regulates your metabolism. You can walk to the moon and back, but if you have a hypothyroid, you're not gonna lose weight. You know, you need to find out why your immune system's attacking and calm that down. That's where your weight loss will come. Every one of my patients loses weight, all of them. Okay, we're a little behind here. Okay, send me a WhatsApp app. Hey, I would go on my TikTok profile and schedule like a free Zoom call with me or DM us it better. We don't go on WhatsApp very much. Okay. Most of my family have thyroid results came back showing reactive thyroid and low folic acid. Okay, yeah, you might have an MTHFR problem that can contribute to Hashimoto's and hypothyroid. Um, yeah, Jennifer Hess, get that figured out. Give us a call. We'd love to help you. Is taking levothyroxine this is Lillian. How are you guys? Thanks for your likes and follows, guys. Is taking levothyroxine for long term of time solving the problem or just covering the problem? 100% covering the problem. There's only 5% of people that are 5, max 10% that have hypothyroid, that taking the thyroid medication is fixing the problem. Because in those cases, it's not like what you have primary hypothyroidism, and they don't know why it's not functioning, it just isn't. And you take the thyroid medication and all your symptoms go away. So even in those cases, that 5 to 10% of the cases, it's really not fixing it, but it kind of is because they're just restoring what your body and the rest of your physiology works just fine. But for 95% of people with hypothyroid, taking the medication by themselves is not gonna change their symptoms, and it's not fixing a dang thing at all. It's only replacing hormone is all it's doing. You need to get to someone, whether it's me or someone, that knows how to, address why you're having the problem and to correct it. Um, your son has hyperthyroidism and vomiting, constant nausea. What can be done? What could be causing this? Well, yeah, it really is upregulating all of his functions. You know, he may have more things, but those are symptoms of hyperthyroid. Hopefully, the medications are helping him. I don't work with kids, you know, so but that's the direction you wanna go is, if he was hyper, if I were you, I'd take him off all gluten and see what happens. Put him on the autoimmune paleo diet. Just try that for 6 weeks, see how he does. I have hypothyroids, what can I do to lose weight? Find out why you have hypothyroidism and fix that why, the weight will melt off you as long as you're not overeating. How important is gluten-free? Super important. If you have Hashimoto's disease, people, you need to be gluten-free, period. And it's not like just a little gluten-free, you know, lowering your gluten-free. No, you either gluten-free or you're not. It's like either you're pregnant or you're not pregnant. It's one of the 2, okay? Okay, let me walk you through, why you need to address yourself when you have positive antibodies, okay? Because this is super important, and this is how things can spread. So let me walk you through this. So here's what happens. You have your pituitary gland here, okay? Your pituitary gland releases a hormone called TSH, okay? And your TSH goes to your thyroid. And what it does is thyroid stimulating hormone stimulates the thyroid to make thyroid hormone. And within your thyroid hormone, you have these cells, okay? And these are called follicular cells. Now, these follicular cells, when this TSH, right? Imagine there's like a button up here for your pituitary gland. Okay, there's a red button on a desk that the box hits, and that releases TSH. Okay. And so when this button's hit, TSH tells the thyroid to start making thyroid hormone. Okay. Now, you guys probably ought to be writing some of this down because you're not going to hear this from anybody else, probably. But this is really, really important. So when this process happens, there's three things that go inside of this cell in your thyroid to make thyroid hormone. Okay. One is thyroglobulin. Another one is going to be iodine. And then the last one is going to be the TPO, thyroid peroxidase. Everybody see that? Those three things go inside of that cell. Now, thyroglobulin. Now, remember when you're dealing with um, TPO antibody and thyroglobulin antibody, those are the tests for Hashimoto's disease. Okay, so TPO, look, TPO, thyroglobulin. Okay, so here's what happens. Thyroglobulin is a protein that gets sent inside of the cells. Let's say like this. Here's the protein. Okay. Then what happens? Iodine goes into the cell. And then what thyroid peroxidase, this is a glue that's gluing iodine to the backbone thyroglobulin. Okay. See how that works? So once this is glued together, then what happens is this gets sent out of the cell and goes into your bloodstream and gets taken throughout your tissues. Now, here's what happens when you have Hashimoto's disease. If you have a positive thyroglobulin, positive TPO, okay? If this is positive, what's happening? Your immune system is attacking the glue. Okay, it's attacking the glue. So now, when all these three things go into the cell, there's no glue to glue iodine to the protein. Kind of like the glue on your stamp on your letter isn't working, so it doesn't get delivered, right? So no hormone is made. And because no hormone is made, this gets kind of like broken down and it stays inside of your cell. And then remember your pituitary gland, your boss is up there. He's like, where the heck is my hormone? So what does the boss do? Hits the red button again. The whole thing starts, and guess what happens? Three things go into the cell again. Okay. No hormone gets made. The button gets hit again. Three things get moved into the cell again. Now, if you have a positive thyroglobulin here, okay, what's happening is your immune system is attacking the protein backbone. So if the backbone is broken, there's nothing to glue iodine to the backbone, so no thyroid hormone is made. This is why you need to get both of these checked, thyroglobulin and thyroid peroxidase, because if either one of them is positive, no thyroid hormone gets made. Okay. And all these products stay inside of the cell, stay inside of the cell. So what happens to this cell is it literally starts to right? It gets bigger and bigger because all these products in here. This is why you develop nodules and goiters. It gets bigger and bigger and bigger. And then finally it hits that critical point. And what happens to this big giant cell that hits that point that it pops? And what happens is like all of these products here, okay, all of these products get spilled out, right? So now you got all these products get spilled out. All these proteins get spilled out in your bloodstream, okay? They get spilled out. Now your immune system gets activated. Oh gosh, we need to get this out of here. So what happens is the immune system comes over here and tags these guys. Well, let's tag that. That needs to get out of here. This one needs to get out of here. But when they're tagging it, some of these proteins look like other tissues in your body. If this one, let's say this one looks like the tissues in your joint, your cartilage. Then you develop when they tag this. Now, inadvertently, they just tagged your cartilage to be destroyed, and now you have rheumatoid arthritis. Maybe this one here or this one here looks like the covering of your brain and spinal cord. So now you just developed multiple sclerosis or MS. Okay. It's called epitope spreading. so it spreads to other autoimmune conditions. So, you went to your doctor and you have a positive ANA, or you go to your doctor, you have a positive TPO, but your thyroid panel normal, everything else looks good. No, it's very bad just to sit on your hands and wait for tissue damage to happen. And when this pops, that cell no longer makes hormone. You have enough of these cells get destroyed, you will become hypothyroid where you need to have replace your thyroid hormone. So this is kinda how all of that all really works, okay? Now the other thing I wanna talk to you because I did a couple videos on iodine. This is why you really have to be careful with your iodine intake because if you have extremely high, amounts of iodine, what happens is there's a thing called the Wolff-Chagat, uh, law that what happens is literally the thyroid will slow production of thyroid peroxidase and actually making thyroid hormone to protect itself. You should only get about 130 to 150 micrograms of iodine every single day, but some of your beauty products can have up to 2,000 micrograms. So you just gotta be really, really careful with that, okay? So with that said, this is why it can spread. Now this is why you need to have somebody find out what's triggering your immune system to attack these things, okay? Um, let's talk about some triggers, all right? Let's talk about some triggers. So what I'm gonna do here is autoimmune triggers. We're gonna talk about that here in just 2 seconds, okay? I wanna give you a bunch of these. I'm gonna answer a few questions, and then we're gonna go to this really quick, okay? So, welcome to those on YouTube. I'm gonna go to the most recent comments here. Let's see here. I'm gonna go with Kim. "I just got my TPO back as 242, all others normal." Yes, you're stage 1, autoimmune. If you have symptoms, you have stage 2 autoimmune, and you definitely need to do something about it because if you don't have one it's not if you have another autoimmune condition, it's when you get it, what kind you get. That's why you need to calm down this immune system. What symptoms will they have? Yeah, if you have Hashimoto's, weight gain, fatigue, brain fog, depression, anxiety, hair thinning or falling out, dry skin, brittle nails, those are common. Lexi Affinity 21, TSH is 0.55, low weight, can't gain. Does this mean hyperthyroid? Could be. Yeah, it could be. Definitely usually a lower TSH, and those symptoms do indicate maybe some hyperthyroid. Have your doctor run a TSI, and do a full thyroid panel at least. Um, Hi, Princess Poofy. Any relation to pituitary adenoma and thyroid nodule? Yes. Yeah, so if you get a pituitary adenoma, because that's where everything kinda starts, right, in your anterior pituitary where your TSH is produced, and really is stimulated by your hypothalamus that tells your pituitary what to do. So really, I erase that. You can get an adenoma that definitely can give you problems. And having an adenoma like that can absolutely raise high prolactin levels that will make you have a hard time getting pregnant. That'll mess up your menstrual cycle. So yes, absolutely, absolutely. Kim, I feel crazy I tip for the littlest thing and feel crazy. Yeah, yeah. Reach out to us. We'd love to see if we can help you. You have no Hashimoto's. Great. That's good to hear. Amy, is there any other different specialists besides endos for Hashimoto's? Amy, there's not. If you're looking at Western medicine, okay, or the typical traditional medical model, they do not treat Hashimoto's disease because the only treatment for autoimmune conditions they use is typically immunosuppressant drugs, basically shut down your immune system, which is I mean, I guess if you're desperate, that's one thing, um but yeah, the side effects of, like, prednisone and methotrexate are so bad that they're worse than the symptoms you're dealing with. That's why you don't qualify when you have Hashimoto to go on those immunosuppressive drugs. But yes, there's a ton you can do. You can put your Hashimoto's into remission, but traditional medicine will not do it. So you do have to look at somebody else, like, typically, like, a functional medicine practitioner that has experience of doing it, and we've seen over 7,000 clients successfully reducing and not reducing, but putting their condition into remission. So yeah, I would say if you're going to go look at someone, make sure they have some track record. If you want to see if you want to apply into our program, see if we'll take your case, you can go to my TikTok profile and then go under the finger emojis, hit on that, and that'll take you to you can do a free discovery call. Okay. Never knew spine was messed up. My doctor gave me my levo and it ruined my nerves, my bone. Yeah. Okay. Why does endos not look further for why you have Hashimoto's? They just monitor your meds. Yeah, Joyce, the reason why that is because the standard of care is only hormone replacement therapy. That's why. That is the simple answer why. Now, there are many endos and probably many, practitioners would love to go look at it earlier. However, it's not earlier, but look into it deeper. But again, there's a lot of reasons why they don't do that. Now, I was treating a, emergency room doctor, and she came to me, she goes, "I've been secretly watching your videos for the past 3 years." This was, like, 8 years ago, and she goes, "I wanna do what you do. I cannot pull the necessary tests because the hospital will not allow me to do it. The group I'm part of, it's not the standard. If I do it, then I get kicked off of insurance panels, and then I lose my job, or I literally would have to go into private practice. So there's a lot of reasons behind it. Now, I honestly believe I've worked with a lot of endos. We have a, medically integrated clinic. We've had multiple different types of, practitioners and medical doctors work with us. Here's the thing, I think they're all great. I think 99.9% of all doctors have your best interest at heart, but what you don't see is some of the behind the scenes stuff. I mean, there's administration. These guys gotta see, 45, 50 people every day or administrations down their throat. Anyone in the biz, right? Anyone that's in it realizes there's a lot of stuff behind the scenes. So I always tell clients that most of them are very upset with the doctors. This is how I tell them, "Listen, the doctors are there, they love you, they want to help you, that's why they're doctors, but what you have, they don't have a good solution for you because there's not a drug or a surgery that's gonna fix your Hashimoto's disease, right? There's not. But they're using what they have, they're trying to help. And I've done this, like, in my garage, I don't have the right tool, so I'm, like, makeshifting some other tool to try to mimic that tool, so they don't have time, the drugs aren't gonna help you, and that's why they don't look deeper with it, because it takes time. I mean, my first consult with patients, I'm with the patient for over an hour, maybe an hour and a half. Imagine your medical doctor trying to, your primary care, your endo, spending an hour and a half with you, literally impossible. That is 100% impossible, but it's 100% necessary to unravel these chronic conditions. I came here in Texas. I'm in Utah, and we can help you no matter where you're located. We are currently in 10 different countries that we're helping people from. So whether you're from Africa or whether you're from, the UK or Texas or Minnesota. Heck, I had a patient that was on a little island up in Alaska. Man, shipping was a pain in the butt, but we were able to get it done. So if you're struggling and you need some help, reach out to us. We can see if you're a candidate. Charity, well, hormone replacement therapy help at all. My endo puts me on, and I don't feel any difference. So we do hormone replacement therapy in our clinic. Now, here's what I tell all of our patients that want to do hormone replacement. Some patients need it, some don't. But just keep in mind, this goes for your thyroid hormone, this goes for testosterone and estrogen, progesterone. Listen, think of those as just all hormones are people. Hormones are only messengers. Hormones tell cells what to do, right? That's all a hormone does. Your levothyroxine, it's a T4 hormone. All that's gonna do is tell certain cells what to do. Your free T3 hormone is gonna tell certain cells what to do. So each cell has their job to do, okay? There's a problem with the cell, the hormone can't get there. You have inflammation that's covering the cell, the hormone can't get in. But at the end of the day, you know, hormone replacement therapy is like adding gas to your car. Okay. Uh, Thyroid hormone replacement therapy is like adding gas to your car. So imagine you go to your car in the morning and turn the key and it doesn't turn on. Notice your gas gauge is on empty, and you're like, I know the problem. It's low gas. So you need to add gas to it. So this is like low thyroid hormone or low progesterone or low testosterone. You load up your car with gas, you go to turn the key again, and it still doesn't turn on. Nothing happened. You don't feel any different. Well, why? Well, because it wasn't because of lack of hormone, because you got it. It's because there's something else in that car isn't working. Maybe it's a battery problem. Maybe it's a starter problem. Maybe there's an engine problem, right? There's a lot of other things that can go wrong because your engine in your car is the one that's using that gas. okay? You have to find out where that breakdown is. But unfortunately, with most traditional doctors, what will happen, um, here's the thing, is most of the time, all you're looking for is the gas gauge, nothing else, not looking at anything else, and that's why so yes, hormone therapy can be beneficial for some people, but if you have a broken physiology and your body can't use that hormone, then yeah, you'll take it and nothing changes. I've seen this time and time again with clients that come to our office, they're on hormone replacement therapy or were, and then they come to us and we actually put them on some hormones, but we say, "Listen, this is gonna be one part, but we gotta fix your physiology at the same time." Suddenly, they're doing the same hormone replacement they did before that didn't work, now they feel amazing. That's how I yes, Paige, we consider genetic influences like MTHFR for sure. I've been dealing with MTHFR. Think about this. When was the first time any of you have ever heard about MTHFR? Okay. I've been dealing with MTHFR since 2009, right? So it's been almost 15 years at this point. So yeah, and we almost all of our clients will get a DNA test. But I'll tell you, only looking at MTHFR is not going to help everything. All right, I got to wrap up here. I want to cover triggers here, and I got to run. But here's some triggers for if you have Hashimoto's disease, you need to look at. Number one is going to be gut function. Okay, um, common like let me do this. Gut infection. Okay, the common ones we see is SIBO, H. pylori, okay, and then H. pylori. Sorry, H. pylori are the big ones. Okay, number two, leaky gut. Right, those are huge things that need to be addressed. Okay, number two, food sensitivities. What you need to stay away from is gluten, dairy, and soy. Okay, come off all those. Do like an AIP diet for 6 to 8 weeks. How you do. Number three is going to be blood sugar. Right, need to have blood sugar stabilized. You need it to be 85 to 110 all day long, including your spikes. I would highly recommend you get a continuous glucose monitor. Measures your blood sugar real time. Okay. The other one is going to be number four, toxins. Could be mold, could be environmental, could be like in your food, like glyphosate. Okay, toxins of any kind. You're always getting exposed, right? That number five could be anemias, right? I can keep going and going and going, and you can see how everything is interconnected. You need to figure all those out. That's a good start. See what's happening. Okay, I can also put on here adrenal function is another one. But yeah, if you're struggling, you need some help, reach out to us. We'd love to see if we can help you and if you qualify for our program. Um, yeah, if you want to get tests, you can reach out to us with that too. So my biggest thing with you, I hope you got a lot from this live, that you learned something more about this, so you can improve your own life. That's the main goal. I mean, most of the time people are gonna need a little bit of help with this. Okay. It can be a little confusing for people, right? Shoot me a like if this is true. It can be really confusing. You watch this live, you go to another live, someone says something different. It can be really confusing. I've seen over 7,000 clients. I've been doing this for 24 years. We know exactly what to do. Don't give up on yourself, and 'cause you deserve to feel amazing because you are amazing, right? You are. And again, I do this because my wife was having very similar problems that you're probably having. Nobody was helping her. We had to figure it out, and we're just taking what we did with her with you guys. So, wish you the best of luck, and we'll probably be live later tonight, probably around 5:30. So feel free to join us. Okay? Yeah. And not yet. Hey, someone's still on live here. If you're watching this, how do I do comments? I need to look this up. I just started doing some YouTube lives, and I'm just not that familiar with it. So if you're still watching, it's just you and me right now. We usually have over 100 or so, 200 people on our TikTok lives. But it's so weird. I cannot figure out why you can't comment. Maybe it's live chat. Oh, maybe because it's not on. It should be on. That might be the problem. Okay. All right. Anyway, thanks for joining us.